Hello, everyone, and welcome to this Trans Health Conference. My name is Carolina Orre, and I work as a Director for Health and HIV Prevention at RFSL, the Swedish Federation for LGBTQ Rights. And we welcome you all. It's so great to see so many skilled activists here today, so I'm getting really nervous. We have quite a full program, but not as full as it sounds from this. Unfortunately, Micah cannot come due to illness, so the afternoon will be a bit distorted. And my suggestion is that we maybe have a bit more time for the panels in the afternoon and have a bit more of discussion. And maybe we end a bit earlier than scheduled. So I hope that's okay for everyone. Micah canceled last night, so I didn't have time to find a replacement. Unfortunately, it would have been really interesting to hear about the work that Micah has done. Yeah, but so what we're doing today is like we have some topics, and we asked all the presenters not to use their whole hour or their whole the whole time. They have to give space for questions and answers, and every panel or speaker decide if they want questions and answers during their speech or after. So we want to give space for everyone to participate as much as one wants. And we will have a person, Caro, who was greeting you. She will run around with a microphone. And it's very important that you use it, since both for accessibility reasons, but also because if you say something that isn't said in the microphone, the live streaming won't catch it. So it will be silent on the web. So that's one important point. We have toilets. There are 4 stairs, and then there are 4 toilets, I think, for everyone to use. If you want to go out smoking, the door is locked, but there is a person here working who can let people in and out for smoking or whatever you need to do. Other things. There is coffee and tea for everyone, so the basic needs are hopefully met. Yeah, so I'm actually gonna just tell you all welcome and open this conference and give the floor, or I don't know, the stage to the first panel, and it's gonna be a speech or a discussion about national guidelines on trans health. And yeah, you can introduce yourselves, I think.
Okay.
Thank you very much.
Hello, everyone. Good morning and welcome to this first session of today. It's, I think, going to be a very interesting day full of lots of discussions and input from lots of different people from lots of different parts of Europe. But today, as this morning, as we're starting the national guidelines on trans health, which is going to be very much a discussion on ways to try and move forward towards an inclusive and comprehensive trans healthcare system in various different places across Europe. But this morning we have, I suppose, an initial focus on both Norway and Sweden. My name is Kat McIlroy, and I am a former coordinator with Transgender Equality Network Ireland and also a former co-chair of Transgender Europe. And my preferred pronoun is they in English or hen in Swedish. And I have with me this morning, to my farthest left, Maria Sundin, who's a current board member with RFSL, which is the Swedish Federation for LGBTQ Rights. And Maria has also been a former secretary and co-chair of Transgender Europe. and is working in lots of different sort of issues around trans experience, but I think primarily looking at depathologization and HIV and AIDS with trans people. So Maria has many years of experience in advocacy, so it's great to have her here to talk about the Swedish context. And also Luca Dalen Epseth from the Norwegian LGBTQ organization, LLH. And Luca's experience has been very much working on, or as an advisor to LLH on gender diversity, and is also a member of the expert group and their report that was recently published in the Norwegian context, reviewing legal gender recognition and also healthcare for trans people in the Norwegian context. So we're here today to have a discussion about the current and previous situations, and also ways to move forward for a more inclusive and comprehensive trans healthcare system. So I suppose just to give some idea of, we have about 60 minutes for this session, and as Carolina said, we hope to give plenty of time for discussion and questions and input from the audience members. So we're hoping to talk for about 30 minutes ourselves here, and then open it up to the floor for questions or comments. I think it would be preferable if there's something that isn't clear or needs immediate clarification, then please ask for clarification. But if you have questions that are about specific things, maybe leave those until the question and answer session afterwards. But if there's something that you feel that you don't quite understand, perhaps then there are other people in the room that also would like clarification. So please do ask for clarification. I'm also conscious that there are lots of people from different countries and different organizations in the room. So when we are discussing or asking questions, just please be mindful and respectful of the fact that we're all from different contexts, working in very different ways and in different sort of legal and cultural systems. So just to be mindful of that, I think, and respectful of where we're at and what we're trying to do in our specific context. So that was quite a lengthy introduction. But just to sort of set the scene, I think for the next sort of 30 minutes or next 60 minutes of discussion. So perhaps then I could start then with Luca and the specific Norwegian context, and if you could maybe talk a little bit about the current situation as it is at the minute and has been, and maybe talk a little bit then about the sort of the changes or the ways forward, specifically in relation to the report that has been issued recently. So if you could talk about the current situation, please, first of all, in Norway.
Yeah. Yeah. To put it short, in Norway you have to be castrated in order to change your legal gender, which means you also have to be diagnosed with F64 transsexualism. A diagnosis you can only get at the state hospital, where there work like 5 people, and one of them is in charge, and she kind of decides who gets access to healthcare and who doesn't. And we don't have this. This is kind of not regulated in law. It's just an interpretation of the law that's saying that we need to be castrated, which has somehow affected how we're working with changing the law, because we're not really changing law. We're changing just a practice. Yeah, and we kind of want to make it into a law. And the healthcare system is pretty bad. Somehow, there's some place between 20 and 30% of the people who seek to get access to healthcare who get it. So the rest is just turned down and doesn't get any help. And the general level of knowledge in the Norwegian health system outside that clinic is extremely low. So if you want to get some help outside of that clinic, you kind of have to know your way about, which means that it's pretty much white middle class people who have access to healthcare outside that clinic. We've been critiquing this for some time now and screaming and shouting, and the awareness among politicians and people working in the state is definitely growing, and people are eager to change. It's just not the activists who are, but it's somehow, to me at least, going quite slowly, but yeah. So in 2013, they decided to make this expert group who was going to look at the requirements for changing legal gender and the whole healthcare system. And the expert group has been working for a little over a year, and we launched our report this spring. And yeah, it was a good expert group in terms of who was sitting in it. We were 4 a user organization present. I think that's good. Yeah, and a lot of different people there were like lawyers and health professionals and people working in social science, and yeah. Yeah, should I say more about what we...
Well, maybe just if you could talk maybe a little bit about the process of that, which you've started to talk about, and also the sort of the difficulties or challenges that you've faced in trying to develop because this report is very much then recommendations of how the Norwegian government may or may not change the legal gender recognition process, but also access to healthcare for trans people. So maybe if you could talk a little bit about the process of the how and why of that, please.
Yeah. The most challenging with starting with to work in that expert group was the extremely not leveled knowledge in that group. People were like, half of the people have never heard of trans people before, and they were like, yeah, they really didn't get it. So the activists, we used a lot of time talking about like how it exists different gender identities and expressions, and how kind of one identity doesn't follow a certain need for healthcare and things, and that was kind of hard for the group to grasp. But once we kind of got over that hill, people were in the group very cool, and especially the advocate part of them were like, yeah, but this is clearly right. It's like, I don't care. They were like, yeah, okay, this is a lot of strange people. I don't get it, but according to the legal thing, it's just, this is piece of cake. We just have to fix it. So that was cool. And also in Norway, we have 4 organizations working on these issues, and one of them are kind of not agreeing with the 3 others. Yeah. So the Harry Benjamin Resource Center in Norway are they're, I would say, extremely conservative. They're gone from being like true transsexual to leaving the whole transsexual thing and going back to we're men and women born in the wrong body, and they're not want to be associated with anything that's trans related, not even if you call it transsexualism. And they opposed to getting rid of the castration demand in the beginning, and they opposed to healthcare for people who weren't binary and healthcare for so that was a struggle in terms of language, like what do we call it when we're not agreeing upon who we are. But yeah, we got around. We're using, the whole report is very gender incongruence, gender dysphoria wording, which is, yeah, you can of course criticize that too, but it's working in a way. And yeah, the whole work of the group got a lot of attention, but all the politicians were kind of waiting. They were like, okay, we have to wait until the report comes. And that was kind of, in a way, affecting the way the organizations were working outside of the group. We were also kind of just holding our horses, like, okay, we'll see what happens. So it's been kind of quiet in the media, except from a lot of personal stories. Yeah. And now they also wanted this process to go quickly, so they started another interdepartmental group, which was just run by people working in different, like the tax ministry and all the ministries that are affected by this, by a possible law change, and they kind of want to see how. What would the consequences be if people with ovaries are allowed to be registered as male and so on, which was cool that I did that, and they also dropped the report to just inside of the state thing. It's not a public whatever, and at the same time as we dropped our report, and they were kind of saying that they're going to smooth out the territory so we can just get this law or get a law and get it into action fast. And then they promised that we were going to have a law proposal out on a hearing this spring. And I think that that's not going to happen. So we have to step up our game as activists. Yeah, my fellow workers are like, yeah, we're going to do that. Yeah.
Maybe I could just ask you then to briefly just highlight then the report's recommendations in relation to the healthcare, but also then the legal gender recognition process. So if you could just summarize those briefly without going into too much detail, please.
The group consists of like 18 or 19 people, and except from 3 points, we are all agreeing on everything, and the two, 3 places we're not agreeing, it's the Harry Benjamin and the existing healthcare system, like the gender clinic, that doesn't agree with the rest of the group. Okay. Surprise, surprise. And the recommendations are short, that people should be allowed to change their legal gender, period. And we are also suggesting that people should be allowed to do that throughout their life, meaning that we are kind of saying that even kids in like 3-year-olds can access. And we, when it comes to like third legal gender, we have just said that we didn't see it as our task to say anything about it, but it should definitely be examined and worked on, and also we need to have a system in order to receive people to our country that's not registered as either male or female legally. And when it comes to healthcare, we shortly said that people should be able to access healthcare and on a lower level in the health system. So you don't have to go to the gender clinic in order to get like hormones and things. And that people who have received other diagnoses than F64 should also get access to healthcare. And we're also suggesting a broadened package of things you can receive. Because like earlier, you haven't had coverage for hair removal, feminizing, facial surgery, and reduction of adamseple.
Facial trait.
Yeah, and liposuction of hips and things like that. Yeah, I think that's...
Yeah. So just then to, because I just had a couple of notes there in relation to the recommendations, just so that everyone is clear, then the expert group's recommendations, which the Norwegian government isn't compelled to accept, these are recommendations, is that legal gender recognition be via a personal declaration of anyone 18 or older, so the individual is then just declaring it, and parental declaration for children under the age of 18, and if you're between 16 and 18, you can do it yourself, with then the county governor's approval.
Yeah.
Okay.
Because we use the same. We were suggesting the same model as you use for people who are under 16 who wants to have an abortion without their parents knowing. So there's like a third part that could come in and say, "This is you have to be able to do that, even though you're not above legal age." Yeah.
Okay. And then also for this to be open to residents of Norway or people who intend to reside in Norway. And very much then I suppose the focus on the healthcare is then an increased expertise and understanding and respect within the overall healthcare system in relation to transgender people or variant or gender non-conforming people. And then the development of national guidelines for trans healthcare, which is then similar to then the current Swedish situation. So, but I think it's important as well to highlight then the Norwegian proposals are very much then separating the medical and the legal in relation to transgender people, which obviously in most countries in Europe still is very much the case. If you're wanting to access legal gender recognition, there are medical requirements that you have to fulfill. So again, it's very positive then that this report is seeking to separate those quite explicitly. And obviously then the medical requirement is requiring a diagnosis of gender identity disorder, transsexualism or gender dysphoria, depending on the language that's used. So maybe, so thanks very much for sort of giving us the idea of the situation in Norway. Perhaps now for Sweden, Maria, you can maybe talk a little bit about the current situation and also how we are now in the current situation in Sweden. So the developments over the past number of years, again with the sort of the review and how then the proposals have become national guidelines. So if you could maybe speak a bit about that, please.
The process that Luca describes in Norway started 2009 in Sweden. And that was actually the first review of transgender care in Sweden that actually included trans people themselves for the first ever time. And a lot of the findings in this review that was published on the 30th of July 2010 were quite clear. I mean, a lot of our transgender care in Sweden sucked. Briefly, you can say the legal system sucked. You were not sure what you got depending on which of the 6 regional teams we have in Sweden you came to. Some had their own bloody guidelines. Then there is an organization of physicians and psychiatrists who is called the Swedish Association for Transsexual Health, which is pretty reactionary and want to impose their guidelines. So in the review report 2010, where also something say Sweden needs to develop guidelines for transgender care. Guidelines that were, so to say, following the international standards, the WPATH, the World Professional Association for Transgender Health Standards of Care, version 7, which were introduced 2011. If you look at the legal situation, we did have a law, the first law ever in the world from 1972. And in those days, it was probably a rather progressive law, but has come to become a very reactionary law. And that law actually also did not prescribe castration, but it said sterilization or unable to procreate. That was interpreted for trans feminine spectrum to have all male genitals removed and gonads and a neovagina constructed. That was basically it. I only know about 2 or 3 people in Sweden who managed to avoid that. That was just take it and you will get your new gender in the gender you want, one of the 2s. Then it was also used for in the masculine spectrum. It was also interpreted as removing of ovaries, removing of urethras, etc., 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 uterus, and all that. So it was in effect a castration law, and it was also one of the things that marred the system was, first of all, they had this notion of there is such a thing as a true transsexual, or a primary transsexual, or a genuine transsexual. And so the only people who could access care were people according to F64.0, which is transsexualism, in the chapter of gender identity disorders, F64 in the ICD-10. And so there was a lot of things of sorting out people using like the gender identity disorder not otherwise specified as a dumping ground for people who they didn't want to see. All this was very, very problematic, I would say. And what happened was that there was a lot of advocacy done from trans organizations, trans individuals, and also a lot of alliances between the political side and the activist side, I would say, plus alliances built between some of the practitioners from the gender teams and activists. We soon recognized that some of the people we discussed with were of the exact same opinion as us. When we're having coffee afterwards, we say, yeah, this whole system is shit, we should do this and this and that. And we built on that. I would call that tactic sleeping with the enemy, because that's my name of it. And it works. I mean, because it's built on a high level of trust, though. I mean, it's not that you one side screws the other. You really have to trust each other and believe that we are working towards a common goal. So, and it works actually in Sweden. Not all of the gender teams are head by people who are very progressive. Some are not. Some individuals in the teams might be. And then to take the next step, like 2011, I remember being at a conference that some of you people were in Linköping, if you remember, the Linköping conference. And the person in charge of the review I mentioned just took me aside and said, well, you must say hello to this person. Has got the been given the task to work out guidelines. And that next step there was that I and another person met up with this person, and we actually spent an afternoon saying what's wrong with the whole system, this and this and that, and just listened and took notes. And then I think it was 2012, we were another of these reference groups where the trans people were formed. And we met up then with the people who were in charge of developing the guidelines.
And those guidelines then specifically have been produced then this year from the Swedish National Board of Health and Welfare. Yes. So there then have been consultations and engagement then with trans people and activists in the creation and development of these.
Yeah, from December 2012, I would say, roughly, and on January 2012, 13 something. It was more structured, and we were presented ideas of guidelines, and the person on the sort of medical side in charge of people who are quite progressive, and they assured us that, okay, we are also looking at the standards of care from WPATH and see if we can, so to speak, model them in a Swedish context, as our systems are quite different. And we went over bit by bit, guidelines for surgery, guidelines for hormone treatment, guidelines for voice therapy, etc., and bit by bit put in different bits and pieces, and they were presented and put in effect in April this year. And those guidelines are guidelines that, how should I put it? They are to be followed. I mean, they can't. One clinic can't.
Mandatory guidelines.
Well, in a way, mandatory. There are different levels of mandatory guidelines in Sweden, but these are viewed as this is the standard of care you should achieve and work. This is what you get. So they cover hormone therapy. In Sweden, it used to be like a process of well over 1 year before you got your hormones, regardless if you've been on hormones for ages, like I've been, for instance, do-it-yourself medication, or if you came to Sweden as a migrant or without papers, etc., been on hormones, or they had to go through this stupid process, I would say. And we try to voice an idea to have an informed consent model, right? Which we in ourselves find is the best way of dealing with hormone treatments, actually. And it's done in a number of countries, especially in the US, I would say. So one of the things is that when I asked one of the chiefs of one of our gender teams the other day, and I said, okay, how do you work? Do you work accordingly? Yeah, they said, it's usually a 3 to 4 month period if people are sort of newbies coming there and want to start hormones. If they're already on hormones, do it yourself, then we put them on through a medical checkup, take the blood levels, etc. And then we put them on the medication they are using if it's nothing against that. So it's basically following the standards of care there. I mean, people who self-medicate should be put on medication in a safe way as a form of harm reduction. Another way, if you look at adults, you also we have 2 sets of guidelines, one for adults and one for adolescents and children, and it's they are different in some cases, but they have mainly the same theme. Another thing is they are developed through thinking of how shall I say it, and trying to achieve a therapeutic alliance between the healthcare professional and the patient/client. Which is a good way. They are based in a dialogue form, actually, which is, if you read the standards of care through, they're also very much that type of language there. Then they also are open to all non-binary people. I mean, they say the criteria to get healthcare, that is that you do have a form of dysphoria concerning your gender. This was done a bit backdoor, because in Sweden we have used transsexualism, and then we have used gender identity disorder not otherwise specified, and we all know that in 2017, if the Russians and some other reactionary forces will not stop us, the World Health Organization will adopt a new set called ICD-11, the catalog of disorders and diseases, etc. And then it will be taken out of psychiatry and put into a chapter on sexual medicine, and will also be named then gender incongruence in adolescence and adulthood, and also in a non-binary context. I think it's reasonably non-binary. As you know, you heard of the DSM-5 as well, the Diagnostic and Statistical Manual of the American Psychiatric Association. They did away with gender identity disorder as well, and replaced it with gender dysphoria, and it's not that, just not the same things, because gender identity disorder says my gender identity is a form of disorder, right? Gender dysphoria says basically that I, Maria, I am dysphoric due to how I'm conceived, or has to do with my gender, not being able to access treatment to develop into the gender I feel, or whatever. So it's a more liberal form. It could be different. I mean, there are voices saying that is also sort of to pathologize people, and I would partly agree with that, but still. So what we did in Sweden was basically that in order to prepare for the new days, and said gender incongruence in Swedish makes like, twisting a tongue a bit. So we said, okay, the Swedish translation, gender dysphoria is könsdysfori, so let's go for that. And we did that in another work group I work with, where we are developing actually a quality register. You heard of quality registers in medicine? I mean, you use them for hip replacement, for diabetes, for God knows what. And these guidelines, or these quality register is also a quality register all forms of health issues in the trans context. You would have like voice therapy, you would have hormone treatment, you will have sexology, you will have surgery, etc. So there will be a rather complex form of quality register. But I think in the end it might have benefits where you can follow. For instance, what I'm after there is definitely to punctuate the myth that people are ruining themselves if they start to do hormones without a doctor. You can see basically there are very few cases that people have harmed themselves in doing so. And that's why we first used the gender dysphoria term, and then all of a sudden it's also just sneaked into the guideline work. And I would say the important thing with the guidelines is that they are, as you put it, they're mandatory. I would say that. And it gives a tool in the hands of the patient, so to speak, and the trans people saying, okay, this is what the guidelines say. Right. And if you say something else, then please explain. And then if I don't like this person, there's a shrink or whatever, I can say, well, thank you very much. Then I would like to transfer to another place, because you can, after the 1st of January 2015, there is a law in Sweden where you can transfer from one of the 6 centers to the other if you're don't think they do the work the way you want it, which is give you quite a good means of choice, etc. And then we had, as in Norway, we do on the 22nd of January, as the committee introduced then a law reform.
And maybe I can just, before you just go and talk to that, just to quickly summarize the guidelines then in relation to the National Board of Health and Welfare's guidelines in relation to trans people and accessing healthcare that were launched in April of this year. So effectively then healthcare will be available to a greater number of trans or gender non-conforming people.
Exactly.
It's not restricted to a transsexualism diagnosis, and also then provides for additional services such as facial feminization surgery and liposuction if required in relation to then an individual's sense of gender dysphoria. And you mentioned then there's specific guidelines for young people, children, adolescents, and also then for adults. And maybe just talk, just to mention then briefly, I suppose, the changes that that Maria was talking about in relation to the sort of DSM and ICD, these international classifications of healthcare that are used in various countries for health insurance and payment process, then like these changes, and even the Swedish and the Norwegian context, is very much as a result of transgender people themselves advocating for these changes and engaging with psychiatrists and psychologists and doctors as peers, I suppose, more so than patients. So educating and informing from a much more human rights-based approach, and whether informed consent is possible in certain healthcare systems, such as Sweden, it's not actually possible. So then this sort of more proposals or guidelines that are informed from a human rights perspective is obviously very important. But I just want to touch on as well then the changes, the advocacy or activism that's been happening in the Swedish context around healthcare, but also then around the legal gender recognition. So in 2013, for example, in Sweden then there were changes around the legal gender recognition, because previously there was a requirement that individuals be single or unmarried, that they were a Swedish citizen, and that then the medical requirements or medical interventions were needed. So those three criteria were removed from the Swedish legal gender recognition law. And now then in January 2015, which Maria was just about to speak about, there's a new legal gender recognition proposal, which will be open then to any resident in Sweden with no medical requirements, and for individuals that are 15 years or older, with then a parent applying for a child between the ages of 12 and 15. But I just want to then talk briefly, before we move on to sort of more general ways forward, if you could talk maybe, Luca, about the situation for migrant and or asylum-seeking trans people who are trying to access healthcare in the Norwegian context.
Yeah, that's complicated. Yeah, but since we don't, the system is kind of, it doesn't follow the same path every time, so it's like unpredictable whether you can access healthcare or not. But in Norway, you could be granted asylum on the basis of being transgendered or gender non-conforming in a way. But you have to have been a resident of Norway or have like a permanent stay thing for 3 years in order to access the normal health care system. Before that, you only access things that are considered to be life-threatening or, yeah. So we take people in on the basis of them being trans, and then we don't help them for 3 years. Like, basically, that's the guidelines. But I do know that some people have been gaining access, and that's partly due to a couple of the people working at the gender clinic, which are actually not totally crazy. They're actually willing to try to help people, especially people who are already on hormones and etc. But no, there's no official guideline, and according to the law, that they don't access healthcare before they've been there for 3 years. So that's highly problematic, especially when you look at the fact that we take them in on the ground of being transgendered, and yeah.
And maybe, Maria, you could also then speak to the possibilities or how these new guidelines maybe provide a better situation for migrants and or asylum-seeking trans people.
Yes, this has been one of the rather terrible things in Sweden, that sometimes hormones has not been considered a medical necessity for migrants, for instance, because they've been denied hormones, etc. And I know a number of people from RFSL and from outside of RFSL, activists, been approached and helped to get people into the system. That's the one side of it. Both people who are here in Sweden without an asylum status, and people who are asylum seekers who just moved here. I have a number of friends from Asia, for instance, who have been moved here with partners, etc., and have problems accessing hormones, and some of the gender teams and said, well, you have to go through an evaluation. We need to know you're true transsexual. And my friends from Kuala Lumpur says, well, I'm 35 years old and I started hormones at 15. What are you talking about? And they still insist on this. And sometimes we try to get shortcuts. And, those of you from Sweden have been involved in this know we have done a lot of numbers and used also our good contacts. But it's been a very unsafe and very unsure situation for trans people. Not just the hormone side, all sorts of excessive healthcare. Like I still remember this woman from I think she was from Jordan and had surgery and developed an infection in her new vagina, and nobody wanted to care with her. So they took her in backdoor at one of the clinics in Sweden and at least cleared the stuff up and put her on antibiotics. But I mean, that's not humane. That's not the way it should be. So what happens now is basically you are accepted at you should be accepted at the gender teams, because you need a referral from the gender team to get to an endocrinologist to put you on the hormones or get you on the hormone treatments. And usually every gender team is teamed up with a couple of specialized endocrinologists that should know a lot about hormone treatments for trans people. So it's that in that respect is a huge positive development. I forgot to mention one extremely special thing with trans kids, trans youth, as I was one of those myself, believe it or not. And if you are trans kids on the onset of puberty, we're talking for those of you who are into Tanner scales, Tanner 1, Tanner 2, on the indication of gender dysphoria, not the diagnosis, the indication of gender dysphoria, they can be put on what is known as GnRH agonists or hormone blockers, not the blockers that you use like for adults, because it's a very special type of blockers that would close down your natal production of hormones, of sex hormones, and which will give the kids a lot of time to reflect and think, and then if they are into, say, well, yes, I think I'll continue, then a diagnosis, they met some sort of gender dysphoria criteria in a more diagnostic context, they will then be put on hormones if they want that. That is a huge relief, I would say, for children, and quite unique in a way. And behind this is that we do have a lot of self-harm, a lot of suicidality among trans youth in this country, as in many countries. And it's especially, I think that's the reason why they focus on this step, as it's a quite costly medication, but it saved lives of trans kids. It gives them a breathing space, which I never got, for instance, etc. So it's hugely important. And there is another law change that people don't think about. The change of law in the law of the social services legislation, the one called Socialtjänstlagen in Sweden, is going to be amended with a paragraph that makes it mandatory for all cities and communes, as we say, all local governments on the lowest level, to make them self-aware of the needs and situation of trans youth in Sweden, regardless if they have any context with trans youth. So it's basically, if you go and say, we want money for a summer camp here for trans kids, and say, well, we don't think there's a need of it. Okay, let me see the investigation. You're under obligation to have proof here. It would put us as activists in a much better situation. So, sorry for that little...
No, but I think that very much adds...
U-turn or whatever.
And leads to this sort of... My next or final question in relation to our session, and then we can open it up for questions. But I would appreciate if you could maybe share your own sort of ideas or goals for ways forward to try and bring about an inclusive and comprehensive trans healthcare system, either within your own countries or more broadly in the European context. Like, for you, what do you think are the sort of the key things that are needed to move forward? Maybe Luca, you can. I I know it's a difficult question, but I think it opens up then for the audience then to sort of share comments or questions, because we obviously, as I mentioned earlier, we're working in very specific legal and cultural contexts, and some things are not possible at the minute, and some things that seemed impossible 5 years ago are now becoming more possible. So just in that sense of looking forward in a more I suppose realistic but hopeful way. So what would you like to see, I suppose, from the Norwegian context, the outcome of this report, for example?
Yeah, in Norway you have free healthcare, and the law as it is today does give any doctor the opportunity to prescribe hormones for people, and there is a lot of doctors in Norway who does that. You just don't get it for free, you have to pay yourself, but you get a real prescription and a follow-up. And the guidelines and our proposal from the expert group is kind of saying that the healthcare should be given at as a low level in the healthcare system as possible, and I really like that, the closeness to the person guiding you and giving you access. And I'm thinking, I'm hoping that we can get these guidelines and educate more health professionals so that more people are able to give healthcare and good healthcare to trans people. And then we can just get slowly rid of the monopoly situation, because then we just we're just getting healthcare other places, and then they're gonna die. That's my plan. Kind of. But I'm and also in Norway we don't have access to a second opinion, which is highly problematic, since it's only one place you can get a diagnosis and you don't get it. And they said, we're going to make a available second opinion choice, and that will either be done in Norway or we're trying to get it in Sweden. But you don't have, we said we would love to go to Karolinska Hospitalet, but you don't have a space for taking on the 130 people who get denied access to healthcare in Norway each year. So hopefully we'll have to make
So hopefully addressing trans healthcare within Norway rather than having to go elsewhere to other countries, which is also the situation in Ireland, or for smaller countries where there's sort of a wish to export the issue rather than dealing with it locally or within the country. So, and perhaps Maria, then you can also share your sort of hopes and dreams.
Yeah, I certainly will. I began with this sort of process within the movement in the early 90s, so it's like a quarter of a century now. But the thing is, what I have found crucial over the years is that trans healthcare is regarded as what I would call any other healthcare. Sweden has a healthcare system that provides free healthcare. You pay a small sum. There's a system, but it's actually healthcare is the regional government issue, and the region is paid for by taxes, and you don't pay. You pay a rather small sum yourself. The thing is that in order for this to prevail, as you told me that, if you, for instance, tracheal shaves and things like that, you have to do out of your own pocket. The thing is that as long as they are seen, as they are in our guidelines, as any other necessary healthcare, there's no difference between breaking a leg or having your tracheal shave, or getting hormones or giving birth or whatever. I mean, all these are. So that, I think that is actually the bottom line here. Because if we have that standard, and that goes, I think, a long way for other countries as well. If it's brought up there, you cannot say, well, sorry, you can't get that, but you can get that. It should, as long as they are put on the same level as any other form of healthcare. It's needed healthcare, then you have come quite a bit. Guidelines are different for different countries, I would say. I would say that the standard of care is one good inspiration, but they need to be taken out of the US-American context, of course. I mean, they are guidelines for a different system, but that's a good base to start. And I think you need to create the respectful peer-to-peer dialogue between caregivers and trans activists, and make sure that you have a broad set of trans activists on board, because I mean we are different people with different needs. For instance, I never identified as male or female, which is put me to keep my mouth shut during the process, of course, because otherwise I've been thrown out. So I'm a true transsexual, but I mean I never identify as a female, but I live and present as a female, which is very fine with me, and I really like that. So create alliances. Also create alliances, and this sounds like swearing in the church, maybe, say, with the LGBT movement, because not every LGBT movement is a true trans inclusive. Sometimes these movements have the tea as an icing on the cake, right? And we see this a lot in my global work. I see it a lot, I would say. Usually used to get fundings. That's a classic. And you get more funding for HIV, for MSM, if you put the T on board, right? And then you don't give a crap about trans people. So that's one of the issues I'm fighting and doing. But anyway, I mean, I also build alliances with politicians, etc., that level. And it's simply to show that segment, that we actually use real people with real needs. We are just not a set of strange freaks. We are just as real and people as they are. And when you get on that level, it's much easier to influence. And you will find yourself in a spot where you will be educating a humongous amount of people in this, as you told. I mean, that's where you're at. And you have to also educate the caregivers. I'll stop there because I have to leave at 1:45. So if you have questions for me, you have to have them before that, because I have a train.
Thanks, Maria and Luca. There, I'd like to then open it up to anyone who have comments or questions or experiences from your own countries or situations that you'd like to share. Anyone? Yeah. And maybe if you could also say where you're coming from, if that's possible too, please. Thanks. Not yet. Not working yet. Maybe try that one.
Try this one.
1, 2.
Oh yeah. Okay.
Okay.
Yeah. Great.
Now it's working.
Yeah.
Good day.
Hello, my name is Stanislav. I'm a member of RFSL, and I worked with LGBT rights in Russia. And I have a question to Luca. Is it possible to change your sex in Norwegian passport to third sex, like in Germany, for example? Thank you.
No, it's not possible. We only have 2 legal genders. Yeah, but the expert group has said that someone should look into it, because like we definitely see that that's the way, that's the direction the world is moving, and also there is a lot of countries where you could be registered as a third gender in some way, and that we need to have a system that can. Yeah, take those people
and do you have a discussion about it? Is it possible to maybe in future to make this law for transgender people?
Yeah, I think so. It's becoming more of a public discussion. It's not a really good public discussion. It's more like, oh, are we gonna go all hen and they as they do in Sweden and be all queer and crazy? What's up with this? But we have at least one political party that's explicitly said we need a third legal gender, so they're lifting the discussion up on a higher level. So and people are kind of writing about it, and the need is definitely there, and there's more people using gender neutral pronouns, which is kind of radical in a way. Yes, it is. And yeah, so the awareness is growing, and it's definitely the direction it's moving. It's just going a little bit slow. Yeah.
And I'm interested, which political party support this changing in law?
It's the Socialist Left Alliance, I think it's called, Socialistisk Venstreparti.
Mm-hmm.
Yeah.
It's a left party.
Yeah, I'm listed for them. Like if anybody knows votes in Norway.
Okay. Thank you very much.
Okay.
Yeah, one more question here. Or comment.
Thank you. Hi, my name is Alex. I'm from Sweden. Thank you for a very interesting discussion and sharing your experiences. I have a question for Luca. Yes. I was thinking about how, if you could describe or if you can comment on in what way the international trans activism in different ways has, if it has, and if how then it has affected your work and your activist work with everything that you've been doing around the new situation in Norway, if it has affected that or
Yeah,
anyway.
I would say that the trans community in Norway is quite like non-affected by the international thing. It's like the people in Norway, we're kind of separated from the rest of the world. We were just up there in the north doing our own crazy things. But the politicians and the people working in the government are quite like highly affected by the things going on in the world. And a lot of the members of the expert group were at the WIPET conference, and they travel around, and their awareness is definitely getting higher, and also we are very interested in the national guidelines that are made in Sweden. We got to look at them before they were done. Like some people from the group in Sweden presenting for us, and we like the model, and and also we looked at Denmark and their legal gender recognition law, and we this is good, but we want to make it better. So we definitely taking from our neighboring countries, at least, yeah.
And can I just also just add to that? I think at a sort of an international human rights sort of platform, in many of this sort of certainly at European level, when Norway and or Sweden are presenting themselves as these champions for human rights in various fora, it also then is very much completely hypocritical if then the rights of certain sections of the community or population, particularly trans people, then are being sterilized and forcibly so, and or without consent, or when they're last year in Oslo Pride, actually at Euro Pride, there was a member in the audience that talked about a friend that they knew who went in for one type of surgery and actually had their ovaries removed when they were also unconscious during the surgery. So we're not talking about sort of, ethical issues. We're talking about potentially human rights violations of torture and that type of thing. So it really is that the sort of serious when countries are presenting themselves as, yes, we are champions, but then allowing very much human rights violations to go on unchallenged within their healthcare system. So just to add that point.
True. Indeed.
Sorry to...
So.
Marie-Louise Holm, and I'm Danish, working in Sweden. So I just wanted to add something also about the Danish situation. Because of course there are quite a lot of overlaps, and we had the law changes in September 2014, and this spring we had new guidelines also for how the healthcare should be, and I think there are some. Well, in some ways, exactly this legal gender. The recognition of the legal gender, and now it takes like 6 months. Then anybody who declares themselves to be trans can get a change of legal gender. At the same time, I would say there are some kind of really bad effects of actually the separation between the legal system and the medical system in that regard. Because, so you don't need diagnosis as a transsexual to get the change of legal gender. But the thing is that the healthcare has been totally monopolized. So there's only one gender clinic at all in Denmark, and so many people are very critical of it. It's extremely difficult to get access to healthcare and to get this diagnosis. There's no recognition whatsoever about being trans without, being non-binary. So, and it has, I mean, the possibility to get hormone treatments, for example, from your own physician has been totally closed down. It's illegal now. Physicians have been prosecuted for doing this. So, yeah, and there are no other gender clinics exactly. So, I mean, there's no possibility to, to demand to get healthcare anywhere else. And, yeah. So there are these kinds of, I think it's really important also to look to this kind of, I mean, that there might be things that are very similar and yet extremely different in different national situations, that in some contexts can have an effect that is considered really possible for a lot of people, and in some is really disastrous.
We really looked at Denmark and we saw where things were going, because we also we were so orientated again towards getting legal gender recognition and medical healthcare divided. So we were we were afraid to talk about the two subjects together. But then we kind of saw what was about to happen in Denmark, that we were focused on a law that's going to get great, and then the healthcare system just crashed, and we were like, okay, so we can't take them separately. We have to talk about both things at the same time. So we were I'm sorry for the direction it's taking in Denmark, but we really saw that, and we were like, okay, so we learn from them. We do it differently. We have to keep two thoughts in our head at the same time.
You want to say something to that?
Yes, there are this discussion on if you want to include trans-specific healthcare in a law and legal gender recognition, and it's actually done. You have Argentina, who has it, where it means that this is what you have. This means that these are your rights to healthcare. Another country who had the first law in 2012 is Iceland, and Iceland also did that. And that has been misunderstood by the outside world a lot, because they see it, okay, so it's only you have mandatory surgery, mandatory everything. No, it's a Bill of Rights for transgender healthcare. And why did Iceland do that? Well, for those of you who follow financial politics in this part of the world, you know that Iceland was one of the few countries who were, first country in Europe basically, who were on the verge of being bankrupt. And that was actually taken in because it was so very easy to do away with those rights once the situation got bad again in Iceland. So it's a pro and cons. And the Argentinians, I know from Mario Cabral, who is one of the people working with this, that they are satisfied with this. They also have informed consent in the law, as you know. So there's not one size fits all here, I would say.
And I think just also to add to the point, and also what you were saying, Marie-Louise, in the Danish context, and in many countries around the world, you have whatever the law says, and then when you have the actual practice, which can be very, very different in many different ways. So although you have these rights enshrined in law or in legislation or policies, the actual practice can be very, very different. So regardless of what your rights are supposed to be or not supposed to be. So,
True.
Yeah, Caroline.
I actually have a question from Maria. We have new guidelines on healthcare for trans youth, and but we only have a few, one or two clinics who takes care of people below 18, and the waiting list is super long, and so they push people to become 18, and so they can direct them to other clinics. So I wonder, these guidelines, do you think they will make other gender clinics work with youth, or is it just not a difference in accessibility there?
Okay, first of all, you have the big clinic for child psychiatry at the Astrid Lindgren Children's Hospital in Stockholm, which is the main hub, right? The politicians in region Skåne, which is the southern region close to Denmark, have decided to open up a second clinic. We are waiting for that clinic to happen, but it's unfunded, but that's in the pipeline. Then the Lundström-mottagningen, which is the clinic in western Sweden, do youth from 16, right? Which they also do in southern Sweden. which means that, oh yeah, this opportunity to be put on blockers needs also a developing of the system, because as you say, the cues are horrendous. You also have, for the adult population, like in some parts of Sweden, it's also going into up to a year. That's absolutely not okay. So there's so many things. Apart from implementing the guidelines, you also need to have, I mean, if you buy a flat, you need to have some furniture to put in that flat, right? That's where we're at now.
And I suppose too, like in many countries, like the numbers of people that are coming forward and wanting to access trans healthcare seem to be growing exponentially every year. I think as more and more people are wanting to access. So there is this then requirement of having resources to fund then the healthcare that's being required. So
it's grown. I mean, you can see that in the Euro study from 2008 that Transgender Europe put out, and you see there's this curve. It's just growing, and you can see it through the statistics of legal gender change. Mm-hmm. Like in Sweden, when I got mine in 1999, there were 16 people, and that's considered quite a bit. And now it's about a few hundred, I guess, or something.
Any more questions? Okay, yeah.
Hello, my name is Ivo. I'm from Norway, and I live in Sweden. I have a clarification question just from Maria. You were talking about the gender dysphoria diagnosis versus the transsexualism diagnosis.
Not really, but yeah.
But I was wondering, do you get the same for those diagnoses, or is it that you need transsexualism to get surgery and you can get hormones with them?
No, that was, I didn't express myself clear enough. I would say we don't use the transsexual diagnosis. We use gender dysphoria as cover it all diagnosis. So if you're familiar with the ICD-10, right? And if you look at chapter 5, the Fs, you have F64, it's called gender identity disorder, and it covers a number of things. Basically, that is the cover all for. And so gender dysphoria, when it's used, means that you have to have one of those diagnoses, either gender dysphoria not otherwise specified, gender dysphoria other, which is a different thing, or transsexualism. And transsexualism is not interpreted as narrow as it has been, I would say. So there's no difference as you access surgery on the same basis as you would access hormones, etc. It depends on the need and what the patient needs, so to speak. I mean, it's that make it a bit clearer, because I know we are waiting for the change in ICD-11, right? Yeah. No, it's not unclear now for it. It might be unclear for the patient, but the caregiver, there should be no difference in what you offer a patient who you might have diagnosed as not transsexual but having gender dysphoria in the past. That patient will be able to access the same thing as if they want to. That's the difference. Sometimes if you want to access surgery, we'll say, oh yeah, you're transsexual, right? Because that's not synonymous if you read the guidelines. Or if you read the ICD, it's not really, it doesn't say that, but it says that people usually want to, right?
I suppose with any new guidelines in any sort of situation, it might take a little bit of time for the new ways to be introduced and the old ways to be recognized as old ways. Yeah. But Vierge, you have a...
Yes, my name is Vierge. I'm at the RFSL Youth. A clarification is that the national guidelines speaks mainly of gender dysphoria. Doesn't divide into transsexualism and gender identity disorder, not otherwise specified. But the exceptions, almost all kinds of treatments are available to all people with gender dysphoria, like top surgery, hormones, voice training, liposuction, reduction of the larynx. The exceptions are the things that are currently defined by law, which is bottom surgery and change of legal gender.
Yeah, bottom surgery is you need a permission from a government body, and that's actually stems from the castration law 1944, which were incorporated in the law of 1972, the law on legal gender recognition. And of course, that might be a possibility to say, no, we don't think you should have surgery. I don't know. We need to see, and we need to fight them. Because in Sweden, we have fought the system through the courts. That's the way we've done. We have been handed the gay and lesbian rights, basically. You know, all the rights. Some of them are rights for us as well, like same-sex marriage, etc., for obvious reasons. But all what's happened in Sweden on trans rights has been go to the court, having pro bono lawyers working for us, and then fighting them through the court and winning. So we've been doing that for the past 5 years or something it is. The first one, I think, was actually a name law. How the name law was then. Yeah. That was 2009, and then it went on. The marriage requirement was still required to be divorced in 2010, although we have a gender-neutral marriage act from 2009. And we said, what the fuck is this? I mean, this is crazy. And actually, so we brought it to court and we won, and it was removed as a requirement. But, oh, God, yeah. Yep. So it would be nice to have things that we don't have to get through the courts. But it's a way. And also needs an alliance. You know, our alliances are important. The good people out there are not that few. There are quite a number of good people who think this is horrendous the way trans people are treated, and we need to team up with them, educate them, and push for change.
I think that's a very good moment to wrap this up.
Yeah.
I'd just like to thank Maria and Luca for sharing their experiences with us this morning, and also the comments and sort of contributions from everyone in the audience. But I think just a final one sort of sentence to wrap it up. Obviously, there's been a lot of progress, some progress in some countries, and no real progress, at least it seems, in other countries. But I think we can all agree that there's still much more work to do in relation to educating and advocating so that we do at some point have a truly inclusive and comprehensive trans healthcare system, not just in some countries in Europe, but across Europe and in other parts of the world too. So thank you very much indeed.